Okay, this video is going to look at complementary and alternative healthcare approaches, which is our second dot point under the critical question: what role do healthcare facilities and services play in achieving better health for all Australians? Now, of course, we're going to start with our syllabus. So the syllabus here says that you need to know about the reasons for growth of complementary and alternative health products and services over the last few years. You need to know the range of products and services that are available, and also how to make informed consumer choices. When we look at our Learn 2, you need to critically analyse complementary and alternative healthcare approaches by exploring questions such as: how do you know who to believe? And what do you need to help you make informed decisions? So let's have a look at some of the reasons for the growth of complementary and alternative healthcare products and services in Australia. Some of these reasons include, and probably the biggest reason, is the increased credibility of many complementary and alternative healthcare services. Things like physiotherapists, osteotherapists who are doing 4 to 6 year degrees in order to get qualified and go and work. They're registered with registration bodies who monitor and govern what they're doing and the treatments that they use. There's been a massive increase in academic research behind a lot of these alternative and complementary health services. And so that research has helped back their use, and then has meant that it's become more widely accepted. We also have a growing multiculturalism in Australia, and particularly when we're looking at Eastern countries are more used to using our alternative and complementary healthcare systems. Health insurance cover has also helped, because our health insurance companies now will cover a lot of payments for your naturopath, for your acupuncture, for your masseuse, for all kinds of stuff. We have really strong regulatory bodies and professional associations now that are associated with some of these various different types of complementary and alternative healthcare products and services. So that does not mean that all of them have really good regulatory bodies, but we're seeing a growing number of regulatory bodies looking after this area. And we also have Australians who are starting to really seek and get a better grasp of a holistic approach to health. And so our Western medical approach is, if you cut your finger, put a band-aid on your finger. If you are sick, then we'll give you a drug to treat the sickness. Whereas the holistic approach is, if you are sick, then what we're actually going to do is strengthen your immune system, because if you're sick, your immune system can fight it off for you. When we think of the range of products and services within the complementary and alternative healthcare, it's good to distinguish between what complementary and alternative healthcare is. So complementary health products and services are used together with Western medicine. So that's often your physiotherapist, your osteotherapist, your chirotherapists, maybe even your occupational therapists. Those kinds of people are often used in conjunction with Western medicine, while alternative health products and services are used instead of Western medicine. So that's more your Chinese and herbal medicines. It might be your acupuncturist, it might be your naturopath, it might be using homeopathy, or what range of those kinds of things are going to be alternative health products and services. So complementary and alternative health products and services in Australia are going to include things like natural medicines, which are your herbs, nutrition, homeopathy, and Chinese medicines. It's going to include supplementation, so your vitamins, minerals, proteins, and vegetable powders. We're looking at some physiological treatments, such as physiotherapists, osteotherapists, remedial masseuses, occupational therapists, some acupuncturists, and also your energy-based systems, which are things like crystals and some forms of massage and some types of acupuncture. And so there's really a broad range of products and services available. Within this, I'm just going to pick 3 to kind of give you a bit more detail about. So a naturopath uses natural medicines, which normally is a combination of herbal medicine, nutrition, supplements, some homeopathy, and sometimes even acupuncture. And they bring that all together, and they'll choose which one is best to use for the patient in front of them with the particular symptoms that person has. If I think about an osteopath is going to focus on musculoskeletal issues in order to help the body function properly. They're into using mobilizing techniques, joint manipulation, and also a lot of massage. Now, when it comes to how to make an informed consumer choice, I actually recommend that what I'm about to talk about, you do for any kind of health service or product that you are going to do. So your syllabus says you have to apply this to complementary and alternative health practitioners. I would recommend you apply it to any kind of health practitioner or any service that you're going to use. So one of the things you need to know is that there are some complementary and alternative healthcare approaches that are not regulated. And so it's important for you to, if you're going to go and be a consumer of these products and services, you need to know which ones are regulated and which ones are not. Okay, it's important for you to know that, and it's important for you to be informed about your choice. Some questions you need to ask as you do this are, how do you know who to believe? So when you're looking at who to believe, you want to look at their qualifications. Do they have some kind of university degree in this area, or do they have like a certificate in this area? Maybe they have a diploma, but then there's someone else who has a doctorate in this area. You need to think about the qualifications of the person. You need to think about their registration. Is this someone who's actually registered with a regulatory body who has to continue to do professional development, make sure they're up to date with their information, those types of things? Are there regulations around it? And then what kind of research is in there to back that person? So is that person talking to you about their product and service and talking about research and able to actually give you names of research, titles of research, and not just say, oh, the research says? You want them to actually be able to quote journal articles when they're doing that. Then you have to think about whether the person is a professional. So that's things like a professor, an associate professor, a doctor, and I don't mean like a GP. I mean someone who's finished a PhD and written 100,000 words and done some research. Those kinds of people are generally at the top of their field. The second question is, what do you need to help you make informed decisions? You really need a reasonable amount of relevant information from reliable sources. So that is, making sure you're getting your information from people who you can trust, making sure you're getting your information from academic research, from professionals, from universities, from educational institutions, because even going to a .gov website does not mean that information up there is actually accurate. It may be outdated by up to about 10 years. You need to also think about things like the philosophy of the treatment. What kind of reasons are they using to justify what they're doing? The process of the treatment. Are you happy with the process and what's involved? Some of the possible side effects, you should know what the side effects are going to be of the treatment. So the qualifications the person needs if they are going to execute this treatment. And also, is there any academic evidence for the effectiveness of the treatment? So I don't want to be taking a treatment when the academic research says that it actually makes things worse, for example. So this information can be sourced from registered bodies, so regulation bodies. It can be sourced from professional associations or from practitioners. You can ask them, what are your qualifications? What's the research? Where is the research? Show it to me. What's involved in the treatments, etc. You need to be asking those kinds of questions.